Hello, and thank you for joining Care Guidelines, NextGen Tips and Tricks, presented by EMR Trainers. So we'll go ahead and get started. What are Care Guidelines? Care Guidelines assist the provider decisions about appropriate health care for specific clinical circumstances. Guidelines can be used to reduce inappropriate variations in practice and to promote the delivery of high-quality, evidence-based healthcare. Like Azara, they let you know what to do for upcoming exam, also referred to as protocol. Where to locate Care Guidelines? You can access Care Guidelines whether you're in Intake, SOAP, the Telephone Communication template, Histories tab, Checkout, or Finalize, as shown in the screenshot. Here is the Care Guidelines workflow. So for number one, you can have the documentation options available for you. So whether it's detailed document, reviewed, updated, or reviewed, no change. Number two, options to filter your guidelines. Okay. So you can add new guidelines, update existing, exclude guidelines if necessary, review immunizations, and review and place orders. Now we'll get into adding a new guideline. So first, you want to select documentation option. Then you want to click on Select Add Update. You want to select the Care Guideline reason under Condition. Then you also want to associate that assessment to the Care Guideline. Click Add or select Add, and then click on Save and Close. Now your new Care Guideline will now show under Options to Filter Guidelines list, as shown on the left-hand side here. All right, Amnel, you want to take over?
Yes, hi. Hi, how are you? Thank you, Sam. My name is Ahmed, and I'll be finishing up the PowerPoint presentation. Age screen for adults. So similar to adding a age screen for pediatrics, you want to go ahead and start by selecting documentation option, whether it be detailed document, review and update, or you're just simply making any other changes in that document or guideline. Select Add Update. Choose the care guideline you want to go ahead and add, whether it's an ACE1 or RB, and health maintenance. Associate assessment to care guidelines. Sometimes this may not be the issue, but if you do get this option, just go ahead and select the appropriate diagnoses, and then select Add. After that, save and close. Again, the new care guidelines will now show under Options to Filter Guidelines list. And also keep in mind that for adults, age screen ages 19 to 64 is permitted once in their adult lifetime. So once you do this age screen for adults, you don't have to redo it again.
Now, completing Care Guidelines. So completing care Guidelines via the Order Management tab. Okay. Select from the options to filter guidelines. Check off guideline you want to complete, and then place order. Okay. So you follow steps number one. Step number two, you check it off, and then you click on place order. In order to complete Care Guidelines accordingly, you must be on the most recent encounter.
Completing care guidelines. I'm sorry, Sam. I wasn't sure if I was muted there for a bit, huh?
Oh, sure. Yeah. No worries. Yeah, you can continue.
So yeah, completing care guidelines. So once under order management, once you place the order for the care guideline, you want to make sure you highlight the care guideline you want to go ahead and complete. And then after that, you want to go into manage select order, and make sure you change the status from ordered to completed. And then once you have done so, just go ahead and click save, and the care guidelines will show on the as completed. And again, I just want to point out again that in order for you to complete the care guideline accordingly, you must be in the most recent encounter. Next slide.
Great.
This is just for you to document decline or perform software. Sometimes patients come in and they already had these screens sent somewhere else, or they don't want to go ahead and participate. So you go ahead and document those guidelines. 2, click inside status box. 3, select decline or perform elsewhere. And 4, select the reason why patient declined. And just go ahead and save and close your window, and it should document the reason for decline or if it was performed somewhere else. Next slide. So here's how to view a completed care guideline. So this allows you to actually view the list or the history list of all the guidelines that have been completed for this particular patient. So there's no need for you to go to a previous encounter. Just go ahead and open up the care guidelines, whether it be in a new encounter, and then just go ahead and click on the select clinical guidelines history link, and you'll be able to see the entirety of the care guidelines that have been completed or have been ordered in the past. Next slide. Any questions, always feel free to reach out to the EMR trainers. We are available via email, emrtrainers@medmed.ucla.edu, and also at other extensions, Rose 77736, SIM 7734, Living 7965, Children's 7431.
All right, thank you, Abnel. I'll go ahead and do the demonstration of how to add a care guideline now. Okay, so I'm already in NextGen. I'm going to go to intake. Okay, now I see my care guidelines hyperlink here. Now what I want to do now is click on care guidelines. Okay. Click on add update. You want to select your condition or for reason. And I'm going to start with the PEDS. Okay, so I'll do the PEDS guideline. All right, click add. All right, and now save and close. Okay, now you should see the ACEs screening show up here with the new due date of 11/6/2021. Okay, and then save and close. All right, so I'll show you how to add for an adult patient if you wanted to add the ACEs screener. Okay. So same workflow. You can still find the care guidelines hyperlink in the intake tab or SOAP tab. Pretty much whichever tab you're in, it'll be available for you. Okay. So if I'm in intake, I'm going to go to care guidelines as mentioned before. Okay. And I'm also going to do, like I said, the ACEs screening. Okay, so you want to go here, click on add update for the condition. I'm going to do health maintenance for adults. Okay. Save and close. Okay. And save and close. Okay. Now the screening should populate now once I added that. Let me just double check. Okay. Yes, here it is. So I'm now added the ACEs screening. Due date is okay. So if I want to go ahead and complete these screenings, okay, as mentioned in the slides, I'm going to go to order management. Oops. Sorry, one moment, having technical difficulty. Okay. First, let me go ahead and select the care guideline to mark it. Okay. Place order. Then you want to save and close. Okay. Now you go back to order management, and then you're able to complete the screening. Okay. So you click on it. Okay. Then status, go to complete, and then save. And then it's now been completed. Okay. And that's how you complete your ACEs screening for either peds or adults. Okay. So thanks again, and we'll see you next time.